When I meet my patients who come in for vitiligo, one of the things I ask them is, what is your goal of today's visit? There's a whole spectrum. Some people just want education, some people want treatment, some people want reassurance. And so I like to ask that in the very beginning, just so I know that I can really deliver on what they're looking for.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, I'm doing pretty well. I've just been thinking, about all of these conditions that we just don't talk enough about, like vitiligo. What do you think?
Oh my gosh, man. I think this is such a big problem for a lot of our patients who come in with vitiligo. A lot of them are, going through a lot emotionally about this condition. Nobody likes to see their skin changes. And for some people, vitiligo can be very dramatic and kind of come on at one shot. Very important areas of their skin, like their face, are affected, or their hands and more. And, a lot of times as a clinician, you get stuck because we know there's some new treatments. We know there's some new understanding of the disease, but, we need some help because it's something that we have a lot of great experts in the country. Maybe we can find someone to help us. What do you say?
Yeah, good thing we tend to find them immediately after the question is asked on the podcast, right, Hadar?
Exactly. I snap my finger and just like that. Whoop.
Exactly. It's a snappity doo-dah, and here it is. So Dr. Neda Elbuluk is joining us from the University of Southern California. She is on the faculty there. She's an associate professor of clinical dermatology. And I've gotten to know Neda over the years. And recently we found out, Hadar, you just were on a conference panel with her. So we've got some good expertise here, especially around vitiligo. Neda, welcome to the podcast.
Hi, thank you guys so much for having me. I'm excited to be here.
Excellent, Etta. And let's go to the beginning because you found some interest in vitiligo, and it's not a disease that most dermatologists take interest in. We all know the basics and we kind of know how to treat it. But what made vitiligo so interesting to you?
So that's a really good question. So when I was in medical school, I spent a year doing a master's of science in clinical research. And during that year, part of our project was to do clinical and translational work. And I was fascinated by pigmentation and really understanding, the melanocytes and melanogenesis. And I was interested in the whole spectrum, like anything that caused skin color to get darker, lighter, total loss of it. And so I started doing research on pigmentation back then. And then I continued some of that research when I was a resident at Hopkins. And then when I got to Penn for my fellowship year, my fellowship director, Dr. James, said, well, you can set up a specialty clinic if you'd like. I said, all right, I'm going to do a pigmentary clinic. And I left it really broad. I just said pigmentation. And I kind of told them the things that I was looking for, people doing scheduling. And funny enough, the thing that I was seeing the most commonly in that pigmentation clinic was vitiligo. And so I always say kind of like vitiligo found me, like I didn't really go looking for it. I was just interested in understanding pigmentation better. And, that tended to be the clinical condition that presented the most at the time in my pigmentary clinic. And so that really started my passion, my interest for it, my connection with the vitiligo community, and then really just kind of delving deeper into the vitiligo world, getting involved with Global Vitiligo Foundation, doing studies. And then when I went on to NYU, which is where I had my first faculty position, and I expanded there to have my pigmentary clinic twice a week, and there was no one really kind of focused on taking care of adults with vitiligo exclusively. And so my clinic just filled very quickly with a lot of vitiligo patients. So it's been extremely rewarding. And now I'm in Los Angeles, as you mentioned, and I continue to see vitiligo patients and really appreciate, it being part of my career.
It's always nice to hear about how people find a passion. And I know you do a lot more clinically than simply vitiligo, although vitiligo on its own seems to be a very complex condition. Can you speak to the experience of vitiligo of a patient, especially if they have darker skin, just, coming from an Indian background and having gone to India? a lot of folks there are just absolutely devastated because they get viewed differently, and it's just so much more starkly obvious when it's on their skin. Can you talk to the psychological impact and also the impact of having darker skin to start with?
Yeah, so I'm really glad you brought that up because, in dermatology, a lot of our diseases that we treat are visual when they're, on the skin. And so a lot of them have psychological effects. But I would have to say, the psychological, social, and emotional impact that I've seen with my vitiligo patients is among some of the most profound that I've seen amongst all my derm patients. And, I think that it's multifold why that is. I mean, part of it is that, it's a chronic condition, like we don't have a cure. And the lack of predictability is really hard for people. The fact that they could wake up every day and they don't know if they're going to look different, they don't know if they're going to have a new white patch somewhere else. And they just feel like they have no stability or control over how they look. And, we live in a world where how one looks certainly plays a role in one's self esteem and how they get treated and how they interact with people. And so, it just really, I think, can affect people in multiple ways, professionally, personally. People have shared how it's affected them, in their dating world and going to work with their families. And to your point, Raja, in certain cultures, it's even less accepted, right? And so, I've had patients from various cultures, including, South Asian cultures, as you just mentioned, who've talked about how, they've been not accepted by family members. It's affected their marriage prospects. They've tried to hide it. Sometimes it's mistaken for other cutaneous conditions that cause hyperdepigmentation, even infectious ones like leprosy. And so people can get stigmatized significantly for it. And what's hard too is the public actually doesn't know as much as we think they know about vitiligo. And so there's a lot of misperceptions too about people not knowing, is that contagious? What is that? How does it affect me if I'm with somebody who has it? And so, there's so much kind of education we still need to do on a societal level to help decrease the stigma for those affected. And, you know, it's fascinating. I used to think that vitiligo, from my head, anecdotally, I thought, well, if you have darker skin, maybe it affects them more profoundly. But I've had patients with really fair skin where you might look at them and not know they have vitiligo, but they are still profoundly affected by it. So I've found that skin color isn't always a marker for, the baseline skin color isn't a marker for knowing, how much it's going to affect them. But, vitiligo is certainly more visible, right, in those with darker skin. So, that can't be denied. And I think for those individuals, if it's in exposed areas, it's harder to hide unless they are using makeup or something else to cover it. And so that contrast certainly is significant. But I find the psychological effects can be profound throughout racial ethnic groups.
You know what was really interesting? When you talk about exposed areas, something that I didn't realize until I was practicing for a little while, maybe you can comment on this, but amongst males, if you don't ask, many times their genitalia are affected and it really affects their confidence so much that they really don't even want to be judged for it. And I don't know if this comes up in women a lot as well, but in men, it really does affect them until they learn to be comfortable with it or until they find treatment. So sometimes these unexposed areas have these hidden psychologically devastating consequences as well. At least that's what I found.
Absolutely. Yeah, no, I'm glad you brought that up because I think assumptions get made sometimes that, oh, if it's not visible, then it must not bother you as much. And that's another assumption that we definitely can't make, I think, as physicians and healthcare providers, because I've had patients, as you mentioned, men and women that have it just localized to genitalia. And they are also equally devastated by it. And many choose to pursue treatment. They want to try to treat it and get better. And the tough thing with the genital area is that, we can't use phototherapy, which is one of our favorite things to use for vitiligo. So we're really more limited to topicals, right? And on that skin, some people respond, but some people don't. So it's challenging, right? We have less treatment options and it can really be very relevant for certain people. So, and again, for people, depending on if they're dating or even if they have a partner, we can't even make assumptions there. I mean, I've had patients across the spectrum, again, who are very distraught and self-conscious about it.
Neda, I wanted to maybe lean into this a little more to glean some of your expertise because I found that when it comes to these issues that are very sensitive, And I do have patients, by the way, who have vitiligo for years. And I ask them about it. They say, I don't care about that. I'm here for my acne or whatever. And I've seen that kind of other side of the extreme, if you will. But I find that when it comes to these sensitive issues, the language we use, the approach that we take can really make a big difference if we actually kind of crack into that sensitive area to find how we can really make an impact on the patient's life. What have you found in your clinical experience when you talk to patients? I think it's really true for experts, right? You've seen a lot of patients with vitiligo, and now you've developed this craft of how to bring up these topics, how to ask about the genitalia, how to ask about what does it do to your life? What does it do when you go to work? What does it do, depending on your cultural background? And maybe it doesn't matter to you at all. How do you handle that? How do you engage patients in that conversation?
Yeah, so I mean, you bring up a great point. It's a very delicate conversation, and I think you have to be very thoughtful and intentional in how you approach it. And it is such a sensitive issue for so many people. So, I think you have to take all that into account. One thing, as I've kind of alluded to already, is make no assumptions, right? And when I meet my patients who come in for vitiligo, one of the things I ask them is, what is your goal of today's visit? And for some people, I find that they just want to know, what is the condition? Is it harmful to them? Does it affect them internally? Some people I have who are devastated and say, I want to know about every treatment possible. I want to get on treatment right away. I have some patients who say, I've had this for many years. I previously was told not much could be done about it. I just wanted to come back in and see if there's anything new. So there's a whole spectrum. Some people just want education. Some people want treatment. Some people want reassurance. And so I like to ask that in the very beginning, just so I know that I can really deliver on what they're looking for, right?
That's brilliant. That's brilliant. I love
Yeah,
that. That's such an important tip, because we come in with the assumptions, like I just mentioned, the patients that come in and say, I don't care about this at all. And a patient who never mentioned it, their lips are sealed, but maybe they're hiding something that they would love to discuss with you. So it's a
yeah.
brilliant opening question. I love that.
Yeah, thank you. No, and I found it's really helpful. And, there's many times where people just have had a prior bad experience. And so because of that, they're conscious of bringing it up or worried about talking about it. And so I just try to really create an open and safe space for them, knowing that they can feel very vulnerable, opening up and sharing about their vitiligo journey. And, I ask them a lot of questions. I really go back all the way in their history, and I want a thorough medical history, know what labs they've had done, like, where they have their vitiligo. So in addition to them telling me where they have it, I always have my vitiligo patients in a gown. So even if they come in and say, I just have this spot on my face or, hands, I still want to know what's their total percent body surface area. I want to look for signs of disease activity, right? Just so I have a better idea of their vitiligo holistically, even if they're going to only choose to treat one area. So, I always have them in a gown. I always, look head to toe. I use a woods lamp as well. There's always a woods lamp in all my rooms. And then, I sort of get to the questions about, what they want to do about it. And if they are someone that wants to pursue treatment, then we kind of go through the different treatment categories, risk benefits, what to know. And then I separately sort of ask them more, psych related questions just about, well, how are they doing in their life? How's, their vitiligo affecting them? And sometimes that just comes out naturally because they'll be talking about it and they become tearful. I always have a tissue box in my rooms as well, because it's not uncommon for people to get really emotional during the visit. They're
Right.
often harboring a lot of feelings about it that they just haven't gotten to really open up about. And once they start talking about it, it just sort of comes out. And so I like to get an idea of, like, are they still active in their life? Are they engaged in school or work or home or like whatever it is that's part of their life? And sometimes there's a family member or friend or partner there, and they sometimes add in a little bit, about how the person may be doing with it. And, if I find that they are struggling psychologically or emotionally, I do talk to them about, do they see a therapist? Or if they are showing signs of depression, anxiety, have they considered seeing a psychiatrist? Because it is a really important part to address. And we are dermatologists, obviously, so we can't address all of that component, but we can at least provide them, guidance and support resources and referrals to make sure we're supplementing their care with that important part as well.
Netta, you speaking my gospel, you had me at gown. I'm just like you. I insist on all my patients, especially HS patients, they are
Yep.
all in gowns. Every medical assistant that starts working with me, I said, I don't care if you hand me the scalpel, sharp edge first, as long as you put all my patients in a gown, because that's when I can provide the best medical care. Hey, I want to get to some treatment because you mentioned the issue of disease activity. You mentioned topical
Hey,
therapy
there's some
and
new topicals to talk
yeah,
about.
I know. So I want to talk to you about that. Can you tell us, how do you decide when to use topicals versus systemic medications versus phototherapy? Do you have a way that you go about this?
Yeah, so I mean, it's a great question, and I typically am doing every case on a case by case basis, right? So one, understanding their treatment goals; two, understanding body surface area; three, understanding disease activity, and then knowing too that certain areas are easier or harder to treat, right? So we know, acral surfaces, lips are harder, right? And we just let our patients know that from the beginning. So if they have widespread disease and they want to treat sort of more diffusely, then we're often looking at combination therapy. I would say even actually more localized disease. I mean, combination tends to be the approach, and combinations usually involving topicals with phototherapy. And I actually like to include some antioxidant vitamins that they can consider as well. I do some basic labs to screen for any conditions that can be associated with vitiligo. So thyroid disease is the most common. Up to a third of people can have associated thyroid disease. So some of my colleagues like to just ask a review of systems. I actually like to just check some of the labs. So I'll check a TSH, a T4, I'll check their vitamin D level, I'll check for anemia and a few other things. So I always do that at the first visit. And then I talk to them about the different categories, of treatment. So, topicals, we traditionally have had our steroids and our calcineurin inhibitors. To Raj's point, we are so excited to have a new treatment, which this past July, ruxolitinib was FDA approved for vitiligo. And this is really exciting because this is actually the first FDA approved treatment for repigmentation for vitiligo. So previously, all of the treatments that we had are pretty much off label except for monobenzoyl ether hydroquinone, which is for depigmentation. So I think a lot of people don't realize that. And the exciting thing is there's more coming down the pipeline. Phototherapy, most of us pretty much use narrowband UVB at this point just because of its safety and efficacy. And so, we're often combining one or more of those topicals with the phototherapy. And then, the data on, and this is in your world as well with the work you guys are doing with Learn Skin, but, alternative treatments is more limited. But there is some data to support, certain vitamins, things like polypodium glucosamine, vitamin E, vitamin C, ginkgo biloba, alpha lipoic acid. So, there's a handful that have a little more data, but, in the spectrum of things, the data is still more limited. But those, are some that could be considered that could kind of be included with their regimen. And if somebody has rapidly spreading disease, we do consider oral steroids. And so, we'll do that usually as pulse dose steroids for, usually a couple month time period. And then with disease activity, I mentioned looking for signs of that. So things like Kebnerization, trichrome vitiligo, confetti vitiligo, those are all signs we look for of really active disease that signal to us, what, this is spreading quickly. And we may want to, if that person wants treatment, kind of be more aggressive with jumping on all options.
You know what would be really interesting? First of all, thanks for taking us through a lot of these treatments. In psoriasis, they had a study where they compared people that got phototherapy. One group just did phototherapy. Another group had mindfulness sessions just during their phototherapy in the room. They had like a little mindfulness talk through while they were sitting in the phototherapy unit. And they compared them. And the people that got the mindfulness sessions felt more eager about phototherapy, and they actually improved at a faster rate. So I wonder if someone should do that sort of a study for vitiligo too. It'd be such a simple thing to add in. So
I love that idea. We should consider doing it. I think it's a great idea. I think there is such a mind-body connection with vitiligo and many other diseases. But, I would not be surprised if, there was found to be some improved benefit in people who just had sort of a better psychological mindset about it. And stress reduction and mindfulness definitely, can make an impact.
yeah, some sort of like hypnotherapy session where they picture themselves repigmenting. I mean, these sort of things have been shown to even be helpful in alopecia areata. So I think it'd
Yeah.
be really interesting. I had a question to you about the phototherapy lasers now. There's a few brands that are on the market, and I know it's used off label for vitiligo, but do you utilize that, especially in hard to get to areas, or if it's just a focal area, say, it's along the hairline or maybe in the genital areas or buttock areas where maybe they won't do as much treatment with the full phototherapy booth. How do you utilize these phototherapy lasers, or do you?
So are you talking about narrowband UVB or what's the
Yeah,
light source?
narrowband UVB. That's right.
Oh,
Exactly.
yeah.
Narrowband UVB.
You can use it along the hairline. I don't do it on genitalia. There's probably some debate there. Some people may feel more comfortable doing it, but I think a lot of us don't tend to use the phototherapy there. The concern has been historically more with PUVA, but I think, there's still theoretical risk that, exists with narrowband UVB. So a lot of us don't tend to use it there. But, there for people that have localized disease, I mean, I love eczema, which they obviously have to come in office to have done. There are handheld machines that can be done as home phototherapy. And I do have a subset of patients that's easier. They just can't get into an office. And so they either will have the handheld ones or, there are larger ones they can get for their home. And so I do have patients do that too, and they can have really nice results as well. I've had patients that just purchase things that they find online that aren't really sort of well controlled. So I don't like for them to do that. If they want to do the home phototherapy, I like to prescribe it for them specifically through, one of a few companies that I work with, and it's much more controlled. And I have to, write a script for they get a code that releases the sessions to them and so forth.
We're definitely in the camp where we're okay with the phototherapy in the genitalia, but I could totally understand, the concern around it. We limit it, but it's interesting to hear that standpoint because a lot of times we get put, and maybe this leads into the next question. We get pushback frequently for phototherapy and even topicals, even ruxolitinib. We get pushback from the insurance company saying that cosmetic services are not covered by insurance. And they keep saying that vitiligo is cosmetic, and they put in their line, they say, yeah, things that are for beautifying the skin aren't covered. And we're clearly, asking for phototherapy, or actually in most cases, it's like ruxolitinib for vitiligo, and they'll deny it with that. Have you seen that? And when are we going to change these insurance companies to realize it's a medical condition, not cosmetic?
Yeah, so unfortunately, I've seen it a lot, and it's extremely frustrating and upsetting. And, we have constantly been trying to push back to make it very clear that vitiligo is not a cosmetic condition. This is an immune-mediated condition with actually quite a complex pathogenesis. And there's actually a nice article that some of my vitiligo colleagues wrote in the JAD that says vitiligo is not a cosmetic disease. And so we actually have several different appeal letters, and these are actually available to any physician who wants to use them on our Global Vitiligo Foundation website, that really pushes back to explain, why coverage should be provided, more about what vitiligo is, clarifying that it's not a cosmetic condition with, several references, peer-reviewed literature that we send back to them. And so I have gone back and forth fighting with insurance companies over this. And, you can be successful many times if you, fight back enough, but, it is exhausting and time consuming. And it's frustrating that at this point we're still having to kind of make these clarifications and arguments. But this still happens for phototherapy and for topical treatments. And I still, Opzelura being on the newer end, I'll sometimes get, denial saying, well, this is for atopic dermatitis, right? Them not keeping up with the fact
Oh
that this
yeah,
was
that's
approved in
true.
July for vitiligo too. So yeah, we are working, from the Global Vitiligo Foundation side to really try to push back on this. And there's been, more advocacy work going, but, we have more work to do still.
Hadar, maybe we need to send Learn Skin to all the insurance company reviewers and then get them up to date on CME.
Exactly. Yeah, absolutely. I agree. And give them a free subscription if you don't mind. I wanted Netta to ask you because we talked about disease severity or location and how to select therapy. What about the concept of segmental versus non-segmental vitiligo? Is that something you consider, and how does that affect how you educate patients and you select your therapy?
So yeah, very good question because they are different, right? So, the first time I meet somebody, I don't declare them segmental from day one, unless they tell me I've had this for X number of years, here's my photos from before, and they can kind of give me that history. But if they come in and they're saying this just started and it's just one location, then we kind of have to watch it, over a little bit of time to kind of be able to say, okay, this is segmental, or this was just early localized disease that, hadn't spread yet. So I initially approach treatment similarly if there's no prior history. But let's say I've seen them over time and it's stable. It doesn't cross the midline. It's just unilateral, localized, not changing. A lot of times those patients don't respond as well to the traditional therapies, or they, will respond somewhat, but then they just kind of plateau. And we've found with the segmental patients, they tend to do really well with surgical therapy. And so MKTP, which is melanocyte keratinocyte transplantation, is really an excellent option for them. They can get, 90 to 100% repigmentation, that stays, like really beautiful result. The challenge right now is that it's not covered by insurance. And there's only a couple places in the US offering it right now. But we are hoping that as that, there's a device that's kind of going through clinical trials and FDA approval now. And if that gets approved, it's going to make it a lot easier for people to do that in their office without needing as much personnel and a lot of things that were required to do it before. So, grafting is still a great option for the right candidate, and segmental patients really are ideal candidates for it.
Neda, you took us through such a scope of treatment and diagnosis and management in vitiligo. I never thought we would go through all this, but hey, remember what I told you in the beginning? You are a wonderful speaker, and you proved it yet again on this episode. So thank you so much for joining us. Thank you for your expertise and your advocacy that you do for your patients. I think it's critical that they have a voice in the leadership of dermatology. So thank you.
Thank you, Neda. Appreciate it.
Thank you guys so much for the kind words and having me on the podcast and, choosing to cover vitiligo, which I think, the more coverage and education we can do for it, the better. So thank you for the work that you guys do and having me on.
Have you ever wanted to help your patients with their diet and stress to improve treatment outcomes, but you don't know where to start?
All the time. I wish we'd have learned more about nutrition and mind-body practices in medical school. Are you encountering patients who could benefit from a discussion that includes topics that they care about, like nutrition and mind-body, but not sure about the latest evidence?
Absolutely, and that is one of the many reasons why I get excited every time we record our Learn Skin podcast. I learn about the latest and greatest in integrative medicine and integrative dermatology with colleagues that I would probably never come across otherwise.
Me too. I love how we get down to the root cause of disease and find new practical tools to evaluate and treat our patients.
Exactly. Now, we hope you enjoyed this episode and our approach where we help you bridge the gap between what was learned in medical school and what is actually seen in the clinic. And for those tuning in for the first time, please check out our previous episodes.
So join us next time.
And let's get integrative.